Hi everyone, I'm Katie and I'm one of the hearing care assistants here at Audiology Associates.
And my name is Taylor Green and I am one of the audiologists here. And now this is all Katie's video. This is actually one of your first removals, or well, not one of your first, but your first week.
It was my first week, yeah. I think it was, if I'm right, 4 or 5 days into actually going live.
Hey, that's good.
I know.
That's good. I was a bag of nerves when I first did mine.
It's terrible. I'm quite nervous to watch it back.
No, it's good to see obviously how far you've come as well. You know, that's one of the the biggest things really, going back over your earlier wax removals.
Yeah.
But
and I think this is why it's the only video in the compilation today, because it took so long to remove.
It's not an easy one either, to be fair. That's a very deep and dry one there.
Yeah, and I guess you can see, like, I'm just sitting on that outer canal, so I'm not getting the proper vision, because I was just panicking, just getting both the tools inside the ear. But obviously that, I'm a lot better at getting that visual now.
There we are.
But the oil actually went in. It's mad how much it changes the consistency so quickly.
Makes a massive difference.
Huge
Difference. If you're able to, obviously we would always, if you was to book in with an appointment with us, you'd always be recommended to use some olive oil, like medical grade, or olive oil that is specifically for the ears, for a couple of days before attending. But that's if you can. Obviously, if you've got a perforation or any other contraindication, then don't use it. Just keep it dry.
Yeah.
But it makes a massive difference.
It just makes it easier for us and a lot more comfortable for you guys.
Yeah.
But yeah, this, I wasn't getting anywhere. I didn't quite have enough experience of the technique, like where you gotta like get the suction, like give it a little wiggle.
See, like how close you are now with the camera. Not in this video, but like where you are now, you're sitting a lot closer to the wax and you're a lot more comfortable with it.
Yeah, you just get such like, 'cause I obviously can't see now if that wax is stuck on any part of that canal. But it's mad. Well, I just go straight in now, obviously. Obviously comfortable enough for the patient.
Oh yeah. Yeah, calling us Taylor.
Never actually had to call her for a while.
No, you haven't, to be fair. You've
doing well.
You're doing really well, to be fair. No, really well. How are you finding things at the moment?
I get a lot easier. Yeah, definitely.
Get more relaxed.
Yeah. You don't need to be nervous. Do you know what I mean? But now it's just like the norm. Also, still coming across the little tricky ones. The ones deep down on the drum.
There's still ones that I can't do. There's still ones I just see that I can't do, and Reese says the same as well. It's part of the job, really. There's nothing you can really do. You can try your best.
Yeah,
as long as you're safe.
Every day's a learning day.
Oh yeah.
Definitely. Nothing gets easier. Not all patients are the same. Do you know what I mean?
No, you want to think as long as that patient is comfortable, as long as you're being safe, some patients might not be happy if you can't remove it, but I mean, it's impossible in some cases. You physically can't do any more than what you can. But no, yeah,
it's mad now, like watching this compared to a removal I did yesterday. Funny enough, a lady had come in. She had never had wax removal done before, but she was starting to have a bit of like irritation. So when I looked, it was two little, on both sides pretty much the same, two little plugs stuck right down in the anterior recess. And I thought, I'll give it a go. So I drowned the, just kept pumping it with oil to try and make it easier. And she was like getting all positions like this and suction down in the chair. I said, I'm not letting this one defeat me. I said, I'm getting it out. And I did, and it was
stay there.
It was a good moment.
Brilliant, well done.
Yeah, but watching this now I'm like, why are you taking so long? Why don't you do this? Why don't you do that? But like we said, that's like the best thing about watching back, innit?
Yeah, it's good. It's good to kind of not judge your own work, but like a review almost. Yeah. You can kind of say, well, that worked well, but this probably would have worked better.
Yeah.
Or it's just you eventually get to that kind of stage where you look at like a piece of wax, I guess, or skin, and you know what tool to use straight away.
Yeah.
Like suction might not always be the best option.
Yeah, you don't give your decision a second thought, really, do you? Just
especially if you're under pressure in a like really busy clinic, if you're like running behind or whatever. We never rush anything anyway, but you're always cautious of the time.
Yeah.
And there are days where you do run behind a little bit. Or I run behind a little bit sometimes.
But it's like when I've had a couple of them now this week when patients say, I've only got an hour on my parking ticket, are we going to go?
Well, you'll be out in 10 minutes.
You can see them like constantly looking at their watch. I'm like trying then to make sure they don't get over their parking ticket, but
it is what it is. There's not much you can do about it, to be honest. But so far so good though. It's starting to get a good peel going on this one.
Yeah, it's snapped off halfway through.
That's moving nicely there.
Yeah.
Now. That's moving nicely there.
But it was.
Trying to lift that up now.
See, the canal is like quite steep, isn't it?
It's almost like an over. Oh yeah, that's my favourite too.
And I actually think because that was the first one I ever used. It was the first one I got comfortable with.
Oh, of course, yeah. My only little like nitpick with the rosin insert is I think the hook is just a little bit too long. If that was a little bit shorter.
Look how bad the shots are.
Couldn't see that then.
Need my binoculars on.
Still better than mine anyway, don't worry. That's lovely, nice and clear there though.
I know. Same both sides. And I thought that was the drum, but that's just, you can see right in the middle it's just skin.
That's just skin, that is.
It was skin.
See, my heart would drop if I seen that in the clinic, to be fair.
I said on the first week I had all the challenges. I'm sure the girls at the front desk were going, how difficult do you think it's going to be?
I had a very interesting first week here as well myself, to be fair. I had a patient that actually fainted on me on my first week.
No way!
Yeah, and Reese wasn't even here. I was on holidays. So I had to get, he was absolutely fine, the patient was great, he was absolutely fine. But
was it the first time?
No, I'd had history of like fainting after like taking blood and etc. But
okay.
Yeah, got so far into the wax removal, and I just remember saying, I feel a little bit funny. And I was like, okay, I'll come out, 2 minutes, that's fine. And then next thing boof, I was just straight over on the floor. I wasn't even looking, I was looking at the computer, because I just wanted to give him 2 minutes just to come around a little bit, and straight over. I had to get the accident book out and everything.
I don't know what I do in that.
It was it was a little bit scary, I've got to be honest, because it's never happened before. Reese has had a few fainters, mind, but this is not something that happens very often. I just got to put it out there. It is extremely rare for you to to have a fainting episode when you're having microsuction done. But
I suppose some people just can't click with any medical procedure, can they?
Yeah, his body just has a really funny way of reacting to it, to be fair. But no, it was interesting. I gotta be honest.
Oh well, I take my first week as quite easy now then.
yeah. I just remember the girls were like running down the corridor, because obviously you don't really hear any bangs in the clinic like this, and I just remember running down the corridor. Are you okay?
I'm fine.
Yeah, I was like, can you give me some water? Like, just help me.
I just gotta wait for him to come back round and
yeah, he was absolutely fine, to be fair.
Oh, good.
But a bit of oil gone in now.
You've got to be done. It took me a while to obviously, because I wasn't very much, what's the word, a fan of using oil then, to begin with, because if it would block my vision, like when you kept touching the little hairs, and it just...
The only ones I would probably not put oil in is if it's like a jungle. If there's just so much hair, it's matted, because it's just gonna get in the way. I've done it once or twice and it's a nightmare.
Yeah.
It's really, really difficult.
But as soon as I put this in, it all started to come away then.
So it makes a massive difference.
Yeah, but again, see, I'm just not getting that scope in far enough. And I can see now, looking back, why I was struggling to do some removals. It wasn't the actual removal itself. It was my positioning.
Yeah. No, I've come a long way, to be fair. Looking at this, I can compare to ones you've been voicing over, not the fair play to you. You've come a long way.
I still have trouble with skin. I think I'll always have trouble with skin.
Oh, it's still. I'm not a fan of the skin. To be fair, there's ones that you'll like doing. There's ones you'll not so much enjoy doing.
Yeah.
But it's just.
Would you all go in with the manual tool there? Or
probably not.
A bit close?
Probably not at this point. What I would probably do here, is, as you are doing there, is try and get that little bit of skin away first.
Right. Okay.
Just to get a better vision, because it does look like there's a little gap there.
Yeah.
But I wouldn't really want to be kind of pushing around that little gap. It's quite deep anyway.
Doesn't look. It just looks like it's one little simple piece, doesn't it?
Yeah.
But it's really not. Then I discovered that so I started coming like more forward.
Yeah.
And pushing it up. Then.
That's it. Again, as soon as that starts coming forward, then I would probably look at maybe using the manual tool. Once that starts pulling forwards, if you lose your grip.
Yeah. But yeah, I was just having trouble getting that piece.
That's what I would do. To be fair, I'd try and get that little bit of skin away first.
Yeah.
And then see if we can lift that, so you know how much space you got then.
Yeah, that's when I just gone by you now.
So you've got a better view, but there now you're in a good position.
Yeah, it just comes away straight away.
See, it's getting
just
that peel.
Little tiny bit there was holding all that in.
You get that little tiny peel, and then the whole thing just starts loosening up.
Yeah.
Makes a massive difference.
It's all come away now. I suppose you could have got in with the manual tool, but there then, really, couldn't you?
I don't know, mind. I mean, you could, but it's a bit of a strange consistency.
Yeah.
I don't know. I think you're doing the right thing there. To be fair, we're sticking with the.
Yeah, you can still see there's lots of skin on it actually, can't you?
You're gonna try and bunch that into the like you are now. Just bunch that into the suction too.
Yeah.
And that should start pulling the rest of it forwards.
Just making sure you've got the full tube.
Yeah, that's it. Roll it forward.
Surface of that, isn't it?
You got it. Roll it forwards now. You've obviously got a good grip there.
Give it a little wiggle.
There it is. Oh. It's obviously holding on with a little bit of skin at the back of that, by the looks of it.
I was trying to get underneath into that bit of dead skin, but
cracking, look at that.
The aftershots are so poor. I do apologise for that shot.
I don't even have aftershots on half of me. Reese keeps whacking me for it. After the videos, he goes, no, you're even joking, I'm joking. That was a good one. I was
upside down for this.
2 centimetres, 3/4 of an inch roughly. Yeah, great. So that was a fab interesting one to go back on one of your earlier ones.
Not bad.
Don't forget, guys, if you do like the videos, you can always like, heart, share, you can follow and subscribe. And if you like the videos, you can always consider becoming members. You don't have to, but you can consider it. So don't forget, you can take care of yourselves. Take care of your ears. And take care of one another. We don't normally do this for between. And we'll see you on the next video. Bye guys. Bye bye.